I see more people joining our webinar, so I think we can get started. So thank you for joining us today. I'm just going to take a quick moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of the webinar. So closed captioning is enabled for today's webinar, and we also have American Sign Language capabilities, which you can activate by activating the interpretation icon on your Zoom navigation bar. If you need any other additional tech support, please send a chat message to the host or me, and we'll address it for you. Lastly, if you have any other questions during the presentation, please enter them into our Q&A area. The questions will be sent directly to presenters and moderators. So just keep that in mind when you're going through the presentation. So next slide, please. I would like to note that the views expressed in written conference materials and publications and by speakers and moderators do not necessarily reflect the official policies of the U.S. Department of Health and Human Services and Substance Abuse and Mental Health Services Administration, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide, please. Today's webinar is hosted by SAMHSA's 988 Crisis Systems Response TTAC. SAMHSA selected Altarum to provide training and technical assistance support to states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care. Along with our partners, W2 Consulting Corporation and Change Matrix LLC, who have extensive experience with crisis services and technical assistance, the CSR-TTAC was formed to support the continued growth of the 988 Lifeline and build a more robust crisis care system. The goal of the Crisis Care Response TTAC is to support a crisis care system that is integrated, sustainable, and aligned with evidence-based and evidence-informed practices. We'd also like to thank Purple Communications for providing American Sign Language interpreters for this presentation. Next slide, please. We'd like to quickly recognize the SAMHSA team. So we do have Jill Mays, who is the Division Director for Crisis System Transformation for the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA. So Jill, if you're here, welcome.
Good afternoon. Can you all hear me? I don't see myself
Yes.
on the screen, but okay,
Yes, you are
great.
here.
Okay. So good afternoon, everyone, and welcome. Thank you for joining us today, and thank you for the work that you're doing to strengthen crisis care in your communities. So before we get started, I wanted to let you know that we see the incredible communications and marketing work that's happening across the country. Whether you're partnering with community organizations, creating local campaigns, or finding new ways to reach people, we notice it, we appreciate it, and we're here to help you implement those plans. So please continue to think of the 988 and Behavioral Health Crisis Coordinating Office as a partner and as a resource. So I was reminded just this week why awareness of 988 matters. My niece and her husband welcomed their first son just a little over a year ago, and this week their son was unexpectedly hospitalized with rotavirus. It was very, very serious. He was very, very ill. And like any parents of young children, they were very overwhelmed and very anxious. But thankfully, they had family that they could call. I was able to talk to them and support them through, but not everyone has that kind of support. The same thing is true for, say, a new mom experiencing postpartum depression who might be struggling to care for both her baby and herself. I remember when my daughter was a baby, she had colic. And that was kind of a critical time for me, and there wasn't really anybody that I could talk to about that. And so sometimes what people need most is just someone to listen, help them feel grounded, and connect them to the right resources. And that's exactly why 988 exists. And today's webinar is about making sure more people know that support is there before they're in the middle of a crisis. So I hope you leave with practical ideas on how to build awareness, how to strengthen trust, and to help people connect to care through 988 whenever they need it. So thanks again for being here.
Thank you
Back
so
to you.
much, Jill. Yeah, thank you so much for your opening remarks. Really appreciate it. Next slide, please. We also have Janelle Norris from the SAMHSA team, who I'm excited to announce as our guest speaker during the webinar. Janelle is a strategic communications leader with nearly 20 years of federal service leading high impact public health communications, marketing, and behavior change initiatives. She currently serves as the strategic and integrated communications lead, supporting national communications and marketing efforts for the 988 Suicide and Crisis Lifeline, where she helps develop strategies to increase awareness, build trust, and encourage utilization of behavioral health resources. Next slide, please. All right, so before we move into today's agenda, I'd like to introduce our workstream team. My name is Kanchao Mai, and I am part of the CSR-TTAC team supporting today's webinar. I'm joined by my colleagues Bree Carr, Megan McGregor, Cindy Rivera, and Yoselin Tercios. Together, our team helps plan and coordinate these webinar sessions, so we're glad to have you with us today. Next slide, please. Now I'll quickly run through today's agenda. We'll begin by reviewing the learning objectives for the session, which will help frame what we hope you can take away from today's webinar. From there, we'll transition into the main presentation led by Janelle, who will discuss strategic communications for 988. After her presentation, we'll have time for questions and answers. So reminder to submit your questions in our Q&A function during any part of our session today. And then we'll close out with our office hours to discuss anything with you related to this presentation, CSR-TTAC, or anything else you may have in mind. Next slide, please. So just a reminder of what the learning objectives for this workshop is today. Participants will be able to describe the role of strategic communications in building awareness, trust, and utilization of 988 and the crisis care continuum, identify key components of effective 988 communication strategies, including coordinated outreach across partners, identify obstacles to 988 awareness and utilization, including stigma, misinformation, and distrust of crisis services, and explain how these challenges may vary across communities, and integrate communication efforts across the crisis continuum, ensuring alignment between 988 messaging and other crisis services such as 911, mobile crisis response, and behavioral health systems. Next slide, please. So with all of that, I'll turn it over to Janelle for the main portion of today's webinar. Janelle, thank you for being here today, and the floor is yours.
Thank you for having me. And give me 1 second while I'll share my screen. Can we confirm that I can be heard and my screen?
Yes, you're all good to go, Janelle.
All right, perfect. Thank you. So good afternoon, everyone, and thank you for having me once again. As Kunchal mentioned, my name is Janelle Norris, and I serve as the Strategic Communications and Integrated Marketing Lead within SAMHSA's 988 and Behavioral Health Crisis Coordinating Office. And today, I'd like to share a communications perspective on one of the biggest opportunities that we have with 988. While awareness continues to grow, awareness alone, as we all know, isn't enough. Our challenge and our opportunity is helping people understand what 988 is, trust the service, and feel confident using it before they ever need it. And so everything we'll discuss today comes back to one simple communications framework. Awareness builds understanding, understanding builds trust, and trust drives action. That's 1 second. Okay. So the opportunity before us, and this is really where our work begins. And the good news is that awareness of 988 continues to increase across the country. Recent national polling, we were lucky enough to get this data and these results just last week. But recent national polling from NAMI found that 74% of Americans have heard of 988. So that's encouraging, and it reflects the tremendous work that you all are doing, the tremendous work that's happening across the states and communities. But as we all know, awareness doesn't necessarily translate into understanding. So only about 28%, and that's reflected here in this data, 28% of Americans say that they're familiar with what 988 is and how it works. So 74% are aware of it, they've heard of it, but only 28% say they're familiar with what it is and how it works. And then nearly 30% have never heard of it at all, right? So that gap is where communicators make the biggest difference. And our job isn't simply helping people recognize the number, it's helping people understand what happens when they contact 988, what services are available, and why they can trust the experience. And so that's why I like to think about communications as a journey. So first comes awareness. People know 988 exists. Then comes trust. They understand the service and they feel confident using it. And then finally comes action. When someone is experiencing a mental health or substance use crisis, they actually reach out for help. So our goal is moving people along that journey before they need it most. So when communicators think about awareness, it's easy to really focus on those key metric that we always hear, impressions, reach, or even just measuring campaign visibility. And those metrics, they do matter. They absolutely matter. But awareness is much deeper than simply seeing a logo or hearing a public service announcement, right? Real awareness means someone remembers the number, they understand its purpose, and recognize that it applies to them or someone that they care about. And so that means our communications have to be consistent, they have to be repeated, they have to be integrated into places people already live, learn, work, and gather. So again, awareness here, the way that we're looking at it is awareness is about recognition, relevance, and recall. Just knowing that, the number exists, knowing how to use it, recognizing when to use it, and actually using it, right? So that's our job as communicators to make sure that we are carrying people along that journey and able to implement and reach our goals and objectives. So, building awareness with intention. I think this is very important because building awareness doesn't happen through a single campaign, right? It happens through repeated exposure in trusted environments. So that includes schools, workplaces, healthcare settings, community organizations, faith-based communities, and your digital platforms that you're on and utilizing every single day. And so the goal is to normalize 988 so that when someone experiences a crisis or knows someone who does, the number already feels familiar. One of the strongest communications principles is making information available before it's urgently needed. So that is our job, really making people aware of this before the crisis, right? So similar to what Jill was saying in her introduction, making people aware that there is help before they actually need the help. Um, and so one of the cool concepts that is displayed on the screen here is a student ID concept, right? If you think about whether it's high school students, college students, the ID is typically in most areas something that they have to carry with them everywhere. I remember being in college and the student ID being how I will be able to print in the library, for example. I won't say how many years ago that was, but we actually did print out our research and have to utilize paper. We didn't have AI, so we were doing the work, and that was how I was able to enter the library, check out resources, and also print my papers that I had to submit to my professors. So one of the concepts that we have on screen here is the student ID concept, right? So it's every day, their regular routine, something that they're constantly seeing, building that awareness. So putting 988 on the back of every student ID will help create, daily visibility and normalize help as a part of their campus life. It's their everyday life. This is who they are for 4 years or however many, it takes them to matriculate through their college experience. And so we believe that awareness today is connections tomorrow. So this is just a ideation. I don't know if anyone's here from the state of Maryland, but good idea here. Um, so from awareness to action, I want to kind of today go over a strategic communications framework um, and just really focus on the fact that different audiences require different approaches. A message that resonates with a teenager may not resonate with an older adult. I can attest to that. Um, Likewise, communities differ in language preferences. They differ in who their trusted messengers are. They differ in cultural perspectives and communication channels, right? And so effective communications really begins with understanding your audience, not asking your audience to adapt to your style. You have to meet them where they are and really speak their language and meet them there when they're there. So here we have on the screen just a people-centered journey that moves beyond messages to create meaningful impact. So for example, what we do, right? We create awareness, we make 988 visible and memorable in everyday environments. And what that means or what that translates to is people know 988 exists. Then we move them along the journey. We build trust. So we earn their trust through transparency, consistency, and community partnerships. Again, partnering with the people that they trust, and people who whether it's they admire, they look up to, they believe whatever they say or whatever they're selling, and they're trusted messengers for our message, right? And so with that, what that translates to is people believe that 988 can help because if XYZ person is my favorite influencer or my favorite mommy blogger or whomever is saying like, hey, 988, I'm making you aware of it, then it's believable, it's actionable, and it's something that they will be more inclined to utilize in those crisis moments. Um, and then what we're also doing is driving engagement, right? So we're starting conversations and normalizing help-seeking behaviors through our communications. And we're also making people feel comfortable talking about mental health and 988. We're destigmatizing the idea of talking about 988 and mental health and crisis or substance use, right? We're also removing barriers. So we're addressing the misinformation. Um, we're increasing accessibility, and we're emphasizing the fact that we're also protecting privacy. That is a huge stigma and a deterrent sometimes. So when we're doing that, what that means is that people can easily access 988 when they or someone they know need it, right? And then finally, in our framework, we are driving action. Um, we're empowering people to reach out and ensure that they get the right support. And then what that in turn translates to is people are actually doing just that. They're reaching out and finding, getting the support that they need when they need it most. So our goal here, again, in this strategic communications framework is to meet people where they are, build trust every step of the way, and then make that action the natural next step. If you don't take away anything else today, awareness, trust, action. So again, why does trust matter? Because awareness opens the door, as we know, but trust is built long before someone needs it or needs help. So people just don't decide whether to trust 988 during the crisis, right? They already know the number, they recognize it, they're locked in. And then in that moment, because they know what it is, how to use it, when to use it, in those moments of, crisis or needing help, they're able to recall. There's a keyword from before where they're able to recall the number and utilize it and get the help that they need. So trust really determines whether someone walks through that door, that awareness door that we opened early on, right? And people don't contact crisis services simply because they know it exists. They contact services because they believe, trust, that they'll receive the compassionate, confidential, and effective support that they need in that moment. And so building that confidence really, like I said, requires transparency, consistency, and authentic storytelling, which goes back to knowing your audience, knowing the language they speak, how they speak it, who they trust to deliver those messages. And so part of that, the foundation of trust here, representation, being able to identify, I see someone who looks like me, transparency, speaking clearly about what it is and what it isn't, consistent messaging, constantly seeing it everywhere you turn. Like you can't ignore it, right? Accessibility and then community. When it's really fully integrated into those spaces that truly represent who your community is, and it's there and it's in your face, kind of so to speak. Um, you have no choice but to, walk through the door, hopefully. So that's our goal. So again, trust isn't really created just through a single message either. And this is how this slide is going to kind of talk about how we as communications professionals, how we work to earn this trust. Trust is really built through repeated positive experiences and clear communication. So people want to know things like who will answer. It's not AI, it's a real person. What happens during the conversation? Is it confidential? Will law enforcement automatically respond? What if I'm helping someone else? So every communication that answers those questions reduces the uncertainty and increases the confidence. So when we put, human-centered approaches into or strategy into our, campaign messaging, we put people first, right? We're using real voices and experiences to create real connections. We're being culturally responsive. So we reflect the diverse communities that we serve, whether it's language, imagery, and the partnerships, right? Um, Speaking of partnerships, we're developing community partnerships where we collaborate with trusted voices and organizations to help extend our reach. And then, like I said earlier, transparency and privacy. We are clear about how we communicate and protect the people that we serve. Trust is not a message, isn't a message, it's a relationship that we build together every single day, every chance that we get to highlight and I hate to use the word promote in this sense, but for lack of a better term, to promote 988. So when we get to the conversation around removing barriers, we know that many barriers to contacting 988 aren't logistical, really, they're emotional. So people may worry that, I'll be judged, or they may fear losing control. They may not understand how the service works. And some may have concerns about privacy or whether emergency responders will automatically be involved, depending on, the severity of the crisis. Um, and our role as communicators is really to address those concerns proactively rather than waiting for misinformation to fill the gaps. So really, one of the things, and you'll see on this slide, is some of the things that we hear and have seen in various studies and just, doing some social listening. But one might be, I don't know, 988 is for me, right? So we have to, in our communications before the crisis, show people they belong. So again, inclusive language, diverse representation, real stories, trusted messengers. We might hear, I'm worried about my privacy. So in our communications, we're leading with transparency. We're explaining the confidentiality. We're being clear about our data practices and our privacy policies. And we're addressing those concerns proactively before misinformation and rumors spread about what it is, right? Um, and maybe lastly, we might hear, I don't know what happens when I reach out. So we remove the mystery around it. We explain the experience. We set expectations. We humanize the counselor. And we really work to show what support looks like. Ultimately, our communication should really inspire action. Although our goal here is to build awareness as we are, in the infancy stages of promoting and building awareness around 988. But we know that ultimately the goal will be to drive action, and that will be the utilization of the resource, right? So what action doesn't mean is encouraging everyone to contact 988 today, right? We're just inspiring it for the future should they need it, right? And so we're making them aware, we're building the trust, and then ultimately increasing that utilization. So again, trust and awareness open the door. Supportive experiences keep it open. 76% of people who talked, this is from a SAMHSA data report, but 76% of people who talk with a 988 counselor rated the conversation as helpful. And so those are the data metrics that we really want to ultimately work to increase, right? Um, People are more likely to reach out again when they feel respected and heard, when they trust the process, when they feel seen and understood, and when they know that support is ongoing. So we're really working to ensure that when someone eventually faces a crisis or is supporting someone who is, they already understand what 988 is and feel comfortable reaching out. The best communications prepare people before the moment that they need help. And I think that's one of the key takeaways here as well today. We want to make sure that we're being proactive and letting people know about it before they need the resource, because ultimately that is what will drive action. That is what will drive increase in utilization, making people aware, helping them build the trust, and know that this is a service that they can use. And then in those moments of crisis, they're turning to 988. Um, so here's one of my favorite slides for today. And that's just around building the five strategic, what I consider recommendations for communicators. And I have to follow this too. But we want to build trust through consistent, inclusive, and transparent communication that meets people where they are. So, really knowing your audiences, we want to make sure that we are grounding your messaging in research and listening, um, tailoring content to cultural, linguistic, and generational needs, reaching people where they are, whether it's a physical space like the doctor's office or even the grocery store. Sometimes when you're in the grocery store and you hear the ads kind of running on the speakers, they're in the grocery store. They may not be in the produce house, but they're in the grocery store. And they're, hearing this message while they're subconsciously not even really paying attention, but that recall will start to sink in because of the frequency, right? So that's the first step is really just knowing your audience, where they are, who they are, and how to best communicate with them. And then communicating with empathy, right? Using people first, inclusive language, sharing real stories. I think that is probably one of the most impactful ways to reach people is showing people who look like them, who may have had a similar experience that they can identify with, and leading with compassion, not crisis. And the third recommendation is to be transparent and honest. Clearly explain who 988 is. I'm sorry, clearly explain what 988 is, what it is not, and how it works. Be upfront about privacy and data practices. Again, addressing concerns before they become barriers. And then step four, building and leveraging those trusted partnerships. So partnering with organizations that people already trust. I'm thinking, for myself, for example, I'm a part of a sorority, right? And so the sorority I trust, right? And so anything coming from my sorority leadership or, just the community groups or my local chapter, I'm going to more than likely trust that message. And so putting 988 in the spaces and places that we already are, it really helps to, spread the message. And we're just basically working our best to equip the partners with the tools and resources to share 988 with confidence, and amplify that consistent, unified message, right? And then lastly, when we get to the fun stuff, the data, being able to measure, learn, and adapt, we want to be able to track both the awareness and the trust indicators. And ultimately, the biggest trust indicator is the utilization. But we want to use insights to improve our messaging, constantly refining, being agile in a sense, whether it's the channels that we're, appearing or the message that we're sending. Using social listening to really kind of gather what people are saying, how people are feeling, what are some of their barriers that they might be, already sharing. If you look at a social media, I always joke and say, look in the comments. Like, forget the post. Sometimes just look in the comments. You'll see how everyone is feeling just based on the comment section. So that's free, research that you can just kind of do, perusing and see how people are feeling about a particular topic. In this case, obviously 988, but being able to assess whether, it's being received well, messaging is connecting with the intended audience or not. And then, like I said, staying nimble, needs and perceptions evolve day to day. Every day is changing here, right? And so we know that sometimes our messaging has to change with it because our audiences are experiencing a multitude of things on a day-to-day basis. And so seasonality, all the things matter, right? And so our goal here isn't just to be seen or heard, but our goal is to be trusted before someone needs it. So I just wanted to leave this here, and I think you all will get the slides. So, but feel free to screenshot this along the way. We really want to make sure that we're building that trust before someone needs us. And so looking ahead, help really feels familiar before it's ever needed, like I said. So our communications plant the seeds of trust today so people feel confident to reach out tomorrow. So someone's first, interaction with 988 shouldn't be during a crisis and likely won't be during a crisis, right? So it might happen, like I said, on a student ID, or it might happen through a trusted friend. Jill may have told her, niece about 988. It might happen at a community event where you're seeing signage or, someone's mentioning it. It might happen on social media. We know that that's happening because all of you all are promoting and sharing 988 with your audiences online. And we're doing it as well too, right? And it might happen in just a conversation. Just you never know when you're talking to someone and they say, oh, I've been going through this or experiencing that, and you say, well, have you ever, thought about contacting 988? Just those organic conversations that happen with everyday people in our everyday lives. There's always an opportunity to share, and you may in turn be a trusted messenger, right? So there's always an opportunity to share the resource with folks. And so our job is to make sure that that help feels familiar before it's ever needed. So um, I wanted to really just leave you all with one final thought. And that is communications is often measured in impressions, clicks, and engagement. But in behavioral health, success is measured differently, right? Success is someone remembering three numbers during one of the hardest moments of their life. Success is someone trusting that compassionate help is available. Success is someone reaching out instead of suffering alone. And so I wanted to, just leave you with this, that together we can ensure that help feels familiar before it's ever needed. And so every message that you craft, every partner that you engage, and every story that you share helps someone find the courage to reach out when they need it most. So again, our 5 things that we want to do as communicators and folks who are working in this space is we want to raise awareness, make 988 visible, accessible, and top of mind for everyone. We want to build trust. We want to use empathy, transparency, and inclusive storytelling to create that connection. We want to increase confidence. We want to provide clear, consistent information that empowers people to act. We want to drive action. We want to remove the uncertainty and make help feel approachable and safe. And then finally, we want to inspire hope because your work creates pathways to healing, to resilience, and brighter futures for everyone. So thank you for your time today. I think we will take some questions.